Francesco Carones. I'm an ophthalmologist. I work in a private practice in Milan, Italy. And my main field of expertise is anterior segment surgery, like cataract surgery and refractive surgery. Yeah, I feel that I'm quite competent and confident in dealing with multifocal IOLs. Well, first of all is patient willingness of getting rid of spectacles, because you may not believe it, but some of the patients really feel the spectacles like the blanket for the character from Schultz, Linus, you know what I mean. But obviously, nowadays, most of the patients really like to, increase their quality of life. They like to get rid of spectacles, and cataract surgery is a wonderful opportunity. So if everything is fine with their diagnostics exams, with their status, with their healthy eyes, well, at that point, I discuss with them the opportunities of getting rid of spectacles, but I don't upgrade the patients in terms of, you may get this, and if you want to get more, you can get that. I do prefer to say your best solution, your best option is taking this kind of choice, and if for any reasons there is a point, a reason for not being able to get to that specific best solution, then we really downgrade the opportunity, the choices for the patients. Then we discuss with the patients about the advantages and the disadvantages, slight disadvantages, let's say the compromises of multifocal IOL choice. But again, in my experience, I feel this is much easier, especially for the patients, because patients still rely on doctors and they don't want to take decisions. They like to be driven into decisions. And what we have to do as doctors is try to match what is the best solution for the patient and drive the patients to go to that decision. The two main compromises in multifocal IOL choice are, first of all, quality of vision at nighttime, and second, spectacle independence. PanOptix has a huge advantage compared to the other multifocal IOLs, and this is the extremely high rate of spectacle independence these patients get. And this is why I like PanOptix quite a lot, because the quality of vision compromise as regards, halos at nighttime and so may still be there, even if it is much less than an issue compared to the past generation of multifocal IOLs. But at least you can tell the patients, you may have a night vision in the worst case scenario that is not going to be the top of the quality, but you will not be using spectacles any longer. And this is the trade-off that you want to offer the patients. Worst case scenario that you can find with the patients is giving them the compromise like night vision issues and not being spectacle independent on the other side. When the multifocal IOLs were not as performing as they are today, the issue related to patient psychology was much more important. So in this way, the patient selection has become much easier, and as you were saying, the population of potential candidates really expanded. Today, PanOptix actually merged these two issues, spectacle independence from one side and night vision from the other, much closer and closer and closer in terms of compromise, makes this selection definitely easier. With some other technologies, we were used to say, let's speculate and pick that specific multifocal IOL which may enhance near vision, referring to like 40 centimeters, rather than an intermediate one, because that specific patient is more focused on reading instead of, for instance, using computers or tablets or so. So it's much more difficult for me to find room for other multifocal IOLs today, just because PanOptix is covering what the other multifocal IOLs were doing without inducing a higher likelihood of having night vision problems.